We will start the session by acknowledging the traditional owners of the land on which we meet today. I would also like to pay my respects to elders past and present for those who on this land. Next slide, please. About the ECCV, Ethnic Communities Council of Victoria. Ethnic Communities Council of Victoria was established in 1974. Since then, ECCV remains the key advocate for culturally diverse communities. ECCV is a member-driven big body, a voice of multicultural Victoria, and always lobbies to the state government on behalf of multicultural communities of Victoria. ECCV's mission is to work to ensure that it remains driven big body committed to empowering multicultural communities in Victoria. Next slide, please. Thank you. Bit of housekeeping rules. I just would like to request everyone kindly keep yourself on mute if you are not speaking. Also, put your phone on a silent. At the end of the session, there will be dedicated time for question and answer. Questions can be written in the chat box as well. You can write your questions in the chat box, or you can raise your hand if you want to ask any question in the middle of the presentation by clicking the option on the raise hand, which is in the options on the Zoom link. Next slide, please. Thank you. Community outreach program. In ECCV's community outreach program, we are a team of community bilingual workers from various ethnic backgrounds. We speak different languages like Arabic, Chinese, English, Hindi, Punjabi, Somali, and also Turkish. Our aim is to engage and support people from cultural backgrounds impacted by COVID-19 pandemic, and also to empower members of the multicultural backgrounds to make well-informed decision about the COVID-19 vaccination. Next slide, please. Here is the content of the presentation, how the presentation will continue. We'll have guest speaker introduction, which I will do it now. We'll also have a presentation from guest speaker. There will be guest question and answer, quick question and answer. After that, we'll be having one of the guest speakers to speak about their life experience, and then we'll have another also dialogue program or team, and then yes, that will be our content of the presentation. Next slide, please. Our guest speaker is Dr. Mohamed Mohideen. Is the head of priority communities engagement in COVID-19 vaccination. Mohamed is a microbiologist and professional member of Australian Society for Microbiology. He also has been an academic in the Department of Microbiology, Monash University for over 20 years. He's originally from Sri Lanka and has been the immediate past president of the Islamic Council of Victoria. And he's also the current deputy chair of the Faith Communities Council of Victoria. He's the current Victorian Multicultural Commissioner. He is the recipient of the Order of Australia, and he is the Justice of Peace. May I now welcome Mohamed, Dr. Mohamed, to present to us COVID-19 vaccination presentation. Thank you.
Thank you, Abdi, and thank you everyone for attending this session, and good afternoon to everyone again. And may I begin by acknowledging the traditional owners of the land we meet on and pay my respects to the elders, both past, present, and emerging, and elders in the gathering who are here with us as well. So I'm going to give you some background of the vaccines and also some aspects of COVID itself. And I think you've got experts who are here with us to talk about some of the aspects and support mechanisms for people with disability as well. So I just want you to think about this. This is a slide I like to reflect on for 1 or 2 minutes. Today we have over 90% first dose in Australia with 83.5% of second dose. And in Victoria, we have over 93% on first dose and around 87% on a second dose. But what I want you to reflect is on the number of cases nationally and statewide. Like if you look at the number of cases, active cases at the moment nationally is about 18,496, of which Victoria is around 14,260. If you look at the number of new cases, it's about 1,100 nationally, and we are around 900 odd in Victoria itself. So then you look at hospitalization, that's 592 nationally compared to what we have of over 357. Same thing is if you look at ICU compared to us. So Victoria is like overrepresented with the number of cases. So we do have a problem. There are more cases in Victoria than in any other state, and looking at the national representation as well. What I want you to also reflect on is the ICU, because that's important. When we talk about patients in ICU, we talk about people going in there after surgery, or people, who have had a heart attack or some accident, and they might be there for 1 or 2 days or 3, maximum a week. But with the patients due to COVID, we find them that they are there for maybe a month or even 2 months. Some of them have been there in ICU. And we also know that when they come out of ICU, they need more support as well. So if we were to have a bigger outbreak, we will have a lot of problems. Our hospitals would be flooded with patients, and we might not be able to cope with our ICU units as well. So it's important for people to realize that this particular disease is not just the normal flu or any other disease, but this can cause a lot of problems and cause a lot of hardship in the community. And if you look at even the number of deaths, like 1,907 nationally to 1,239 in Victoria. And since September, we have lost 419 people, and most of them were unvaccinated people. So it's something to reflect on, something to share with our community, that there is this big concern that COVID is affecting a lot of the unvaccinated people more than the vaccinated people. So when we talk about COVID, symptoms of COVID are very similar to that of your normal flu or the common cold, or even people suffering through hay fever, sore throat, cough, runny nose, shortness of breath, loss of smell, fever, chills. So it's important, if people have any of these symptoms, that they get tested as soon as possible. What we find in the community is that many people ignore these symptoms and do not get tested. And what happens is they go into the community and they could be spreading the infection to other people. Because during the first few days of infection, sometimes it's called the eclipse period from a scientific point of view, but it's a period that you might not show symptoms. You can be asymptomatic at that stage, but you can be highly infectious. And this is what is happening. This is what our numbers went up during the peak of this particular wave. So it's important that we think about getting tested, or we pass the message on that we get tested as soon as we have any symptoms. I've got tested over 7 times in the last few months, but it is something that I think we do to protect our families and protect our community. Now, when we talk about vaccination, vaccination is one aspect of prevention. It's not the total aspect of prevention. What we refer to is as COVID-safe behavior or COVID-safe practices. And today, from the government perspective as well, we are learning to live with COVID. We are not eradicating COVID at the moment. We are learning to live with COVID. So there's always going to be some people in the community who might be infected. So in order to protect ourselves, protect the community, and prevent the spread, we have these COVID-safe practices, like wearing your mask. At the moment, it's mandatory to wear your mask if you're going to any place inside, and if you cannot socially distance as well. We need to wash our hands and use hand sanitizers wherever we go. We also cough or sneeze into our elbow. in human beings, there's a reflex action of touching our eyes, nose, or mouth once every 3 minutes. You can test this when you go home, or you can just observe yourself how many times you might be touching your eyes, nose, or mouth during the day. So it's important that if we were going somewhere outside to be careful about it, because we could be touching surfaces where a person, potentially a COVID infected person, could have touched. And when you touch your nose or mouth, you can easily get infected, because our eyes, nose, and mouth are some of the direct points of entry for the virus into our systems. We also have to check in everywhere we go. Today, we have to be double vaccinated to many places. From the 29th, I think the rules get tighter, especially in retail surroundings, that you have to be vaccinated as well. So if you're unwell, you must stay at home, get tested and stay at home until your results come. If you are isolating for the 14 days, you stay at home, you don't go out shopping, you don't go out marketing. Somebody else needs to do that, or there's support available from the government to help you get you the essentials to your home. The government also has some financial aid for people who might be day wage earners, and due to quarantine, they might not be able to go to work. So there is support of $450 for short-term stay if you're staying 1 or 2 days until your results come. But if you're quarantining for the longer period of 14 days, there is a $1,500 grant available through the Centrelink, but you need to show proof that you have been unable to go to work and you have a loss of income. So getting vaccinated is important, but also making sure you keep abreast of all the new regulations that come out, and also check for exposure sites on the website as well. Now, the general test that is normally done, the most accurate test that is done, and many people have got tested, is the PCR test. So you do the PCR test if you have symptoms, if you are a close contact of someone who has a COVID and are required to test. If you have had a positive rapid antigen test, I'll talk to you about rapid antigen tests, because lots of people are talking about it these days. So if you've had one of those, you've had a positive result, you need to get the PCR test done and confirm. If you require, as I spoke about the test isolation payments, you need a PCR test. A rapid antigen test is not good enough for that. If you require clearance tests, when you've done your 14 days or 7 days, as it might be for different people, on day 6 and day 13, you will get tested. You need to do the PCR test to be able to get clearance, to be able to leave your quarantine system, or otherwise informed by the Department of Health. So what is the rapid antigen self-test? So this is available these days in supermarkets, and you can buy them from pharmacies. The advantage of this test is that it is you get the results within 15 to 30 minutes. But one thing you need to understand, that this is not 100% accurate. It can give you a false negative or a false positive as well. So the best test is the PCR test. So if you do have a positive test of the rapid antigen test, you must then test with the PCR, because you obviously have COVID if you got a positive test. So again, once you test and you get the results, whether you do the rapid antigen test or the PCR, you isolate, get the formal PCR test done, and then you remain in quarantine. So when you are coming out of quarantine, you need to do the PCR test. With the rapid antigen test, the way it works is if you are testing on a regular basis, like some companies, people have to test daily. So the test sometimes 3 consecutive results over alternate day for between the 6-day period gives you a more accurate result than a one-off test that you would do. Again, the rapid antigen test is not free. You have to pay for it. I hear it's about $15 to $30, whereas the PCR test, you do it in, it's free for any person who needs to get it done. There's a whole lot of test kits available on the federal government website. Check for which ones are approved. Don't just go and buy any test kit. Just check which ones are available and which has a high level of accuracy as well. So now we come back to close contacts. The term close contacts has undergone a lot of changes. In the past, if you have been exposed, you've been to a site or hotspot, you would be considered to be a close contact person. But now the definitions are much more defined. So a close contact person is one who has come face-to-face contact or spent time in a closed space with someone who has COVID while they were infectious. Someone has been in an outbreak or other settings where there's high risk of transmission. And it might be that you're also living in the same house or similar setting like a boarding school or hostel. Being indoors together, including a car, if you've spent a long time, you have to spend in a car, lift or public transport, or you've been to a public exposure site, or sometimes, especially for people who are working in the medical laboratories, that if they have had, where there's been some accident and you've been exposed to some of the body fluids, then you will be considered to be a close contact person. Now, the quarantine period is varying depending on whether you're a full vaccinated person or a partially vaccinated or non-vaccinated person. So if you are living in the same house, irrespective of being fully vaccinated or non-vaccinated or partially vaccinated, you need to quarantine for 14 days. But if you are fully vaccinated, but do not live with a confirmed case, you then quarantine for 7 days. If you have not had any vaccination, you have not had neither dose, then you quarantine for 14 days. 7 days is only applicable for a fully vaccinated person who does not live with the COVID patient. If someone you live with is identified as close contact, someone you is identified as a close contact, initially those people, the whole family would quarantine, but today, if the person you're living at home is considered to be close contact, you are not required to quarantine at all and do not have to stay at home. So all close contacts must try and isolate from other people within the household as practical as possible. So leaving quarantine, so the PCR test is done on the second last day of the quarantine period. If you're doing a 7-day, then it's the 6th day. If you're doing a 14-day quarantine, it's the 13th day. Once you've done your tests, you will get a message from the department saying either if you're positive, then you can continue with your quarantine. If you're negative, you would be able to then leave at midnight on the 14th day, you'll be able to leave your quarantine setup. So today we have 3 vaccines which are very effective. All 3 vaccines have been shown not only in Australia, but internationally, they're all effective vaccines. There are about 21 different vaccines, but in Australia at the moment, we have only 3. The AstraZeneca, which is called Vaxzevrica, which is the international commercial term. We have the Pfizer, which is Comirnaty, which is, and Moderna. The AstraZeneca is your traditional vaccine where you have been immunized against many infections, many childhood immunization programs. It is the traditional vaccine of using non-pathogenic attenuated strain where you incorporate the genetic material, and that is vaccinated, and that will again create your antibodies and keep that in your memory. The 2 other vaccines, the Pfizer and Moderna, they're both mRNA vaccines. Again, mRNA vaccines are not new to the world. There have been research been done since 1961. The last major mRNA vaccine that was used was against Ebola when there was that outbreak in Africa, and that was the mRNA vaccine. So mRNA vaccines are really effective. Again, what is happened is the genetic material is incorporated into the vaccine, and that is injected into you. So all 3 vaccines, the way they work is they produce the spike protein. On the surface of the virus, of the COVID virus, is structures called spike proteins. They produce the spike proteins on the surface. They produce the spike proteins when you get injected with the vaccine. Immediately your immune system is kickstarted, and over a 2-week period, they produce the antibodies which will then target the spike proteins and destroy it. But something to remember, you are not being injected with the live virus. You are not getting the COVID virus into you. What you're being given is a genetic material to produce the spike protein. So no way are you going to get COVID by these vaccines as well. Now, one thing about vaccines, no vaccine can give you 100% immunity. So all vaccines will work to a high levels of 90, 95%, 98%, no vaccines. So even though you get vaccinated, there could be a chance that you can get infected. And we know there have been cases of double vaccinated people as well. So that is something to think about, and that is something to remember as well. So today we have the virus this is the property of any virus. Viruses undergo changes. They can have small changes or large changes. And sometimes the large changes bring about making the virus more pathogenic, more infective as well. And this is what we are seeing over the period since the beginning of this pandemic nearly 2 years ago. We have had over 11 strains that have been identified, and it is not going to stop there. There's going to be more strains that will come as we go over the next few years, and we will be, the vaccine people who are preparing this vaccine will be developing responses in the vaccines against the new strains as well. Today, what is found in Australia is this 11 strains have been there. Today, we are dealing with the Delta strain, which is found to be more transmissible. Just the fleeting contact is enough for somebody to get infected. And we know if somebody, one person in the house gets it, generally the whole household is picking up the virus as well. We are also finding that people are, it's requiring people to get hospitalized. We are also finding that it is also causing reinfection. We are finding also it's affecting a lot of young people, especially this particular Delta strain has been found to have infected a lot of young people. Nearly 60% of people infected are below the age of 40. Today we are talking about 14,000 active cases, 60% of that is below 40. We have about 20% of the total population under the age of 9 years. So you can see it is affecting a more younger population than the older population. Not that it doesn't infect other people, but it does, but the percentages wise, we are seeing a higher percentage in the younger people. So again, this is some data from Johns Hopkins, is one of the leading medical research institute in the USA. They did a study with young people, 21% ended up in intensive care, 10% were placed on the machine or ventilators, and 2.7. And these were all unvaccinated people. And what we are finding across the world, in many cases, in many ICU units, that it's unvaccinated people that end up in these ICU and needing also ventilators. So the good news is all three vaccines are effective against the Delta strain as well as the Alpha strain. After the first dose, you can build up to 88%. After the second dose, you can go up to about 98%. So the vaccination, what it does is it prevents severe disease, the hospitalization, ending up in ICU, and also preventing death to a certain extent. So when we talk about vaccination, there's always, with most vaccines, you have some side effects. So it can be like with all three vaccines, you can have pain, tiredness, headache, aches, and fevers. Generally, for Pfizer and Moderna, it is seen after the second dose. With the case of AstraZeneca, it is seen after the first dose. But you need to understand that sometimes people will have no side effects at all. I had AstraZeneca, and one of my friend who had chemotherapy, who was being treated for cancer, he also had AstraZeneca. Both of us had no side effects, whether it be from the first dose or second dose. So it depends on the individual. Sometimes people will have no. That doesn't mean the vaccine is not working. It is each person's immune system, the way it functions as well. What I wanted to touch on was the anaphylaxis reaction. Some people will have a very severe allergic reaction to some vaccine. And we find that even with Pfizer and Moderna or AstraZeneca, that this is possible, a very small percentage. So what happens is you'll have difficulty breathing, you might have swelling of your face or throat, a fast heartbeat, a rash or a body dizziness, and this occurs in the first 15 minutes. So this is why it's important, you will be told this when you go to get vaccinated, that you must remain in that particular place for 15 minutes under observation. So there is the medical support available if you do get this, and we have seen this happen in some of the mass vac sites where people have just fainted while they were sitting during that 15 minutes. But no one has died. It has not caused severe complications. Everyone has been able to be supported, and they've all recovered as well. Now, we have TT clotting. This is again it's not a common thing, it's rare, but it can occur. This occurs in the 4 to 30 days. We know today the various symptoms. In the beginning, we were not sure. Today, we know all the symptoms. So if you have any of these symptoms, chest pain, severe headache, swelling, which continues, starts around the 4th day and continues and goes on, please seek medical attention, get to the hospital, it is treatable, and people have recovered. What you need to know is that you can get clotting due to COVID infection itself. The chances of getting clotting due to COVID is 16.5% compared to the vaccine, which is 0.004% or 1 in a million. So again, you weigh the pros and cons, and it's more effective to get vaccinated. In Australia, over 13 million doses have been given. We have seen around 158 reported and confirmed cases of TTS. Unfortunately, we lost 8 people, 6 women and 2 men. This happened in the early stages. We have not had any cases or deaths in the last few months. We have not observed any of those as such. With Pfizer and Moderna, this can be some people, again, these are rare occurrences, but this can occur that some people will develop after vaccination myocarditis or pericarditis. What we are seeing is it's more in the young, between the ages of 14 to 30 or 16 to 30, and lots of time in the males, but it can also occur in young females, very active people. This can occur sometimes. This occurs between the first to 10 days after vaccination. Again, we know the symptoms: chest pain, shortness of breath, irregular heartbeat, pain with breathing, fainting. If you have any of these symptoms, please get to the hospital. It can be treated. Up to date, we have not heard of a single fatality in this instant. Everyone has been treated. Everyone has been able to get back to normal. What you need to understand is you can have myocarditis or pericarditis commonly in the population. It can be due to various reasons, sometimes due to other viral infections. You can see in the males, there's 37 per 100,000, of females, 16 to 100,000. This can happen without vaccination as well. We also know that COVID itself can cause myocarditis. So sometimes the infection itself can cause the same problems that the vaccine could cause in few people. So again, this is something to consider, that the chances of getting some of these side effects due to COVID itself is much higher than getting it through the vaccine. So sometimes what we see is post-COVID, that people, because the virus not only targets your lungs, it targets your nervous system, targets the kidney, liver, and other organs. This is why sometimes we find people in hospital where their organs have collapsed. They are on various life support machines to keep them alive in the ICU. They have been put in deep coma, and they are kept alive by these machines. So you can have, after COVID, even if people recover, sometimes people will have the inflammation of the heart muscles continuing. We know lots of young people who have recovered from COVID still suffering 6 months down the track, 7 months down the track, with finding difficult to breathe. If they do strenuous exercises, it can be because the lungs could have been affected. You can have also some dermatological rashes, and also it can have some neurological side effects, loss of taste and smell, and also people finding difficult to sleep in the night. Now, post-ICU, sometimes people have, they're found to have depression, anxiety, changes in mood, and sometimes post-ICU, people need more support and ongoing support for a longer period of time than when they, than normally, which would happen. So these are some of the, it's called the long COVID effect, and we are seeing this in the community, not only in Australia, but right across the world. This is being reported as we move forward. So again, when you get in hospital, and if you're in ICU, we have seen that it can be the post-intensive care syndrome, it's referred to as, where people need support even when they get home. Or we have the post-traumatic stress disorder, when they've been in ICU, they've been in isolation. When they come out of it, they have a lot of support, and also having a lot of mental health issues, which need to be supported by psychologists and counselors as well. So another aspect was pregnancy. There's been a lot of false information out there that the vaccine causes infertility in both males and females. This is false. This is not true. Lots of studies have shown that the virus itself can cause problems. There can be a drop in sperm count in males, and that also can have effect on the menstrual cycle in females. But there's been no scientific or medical evidence to show that the vaccine is causing infertility in males or females. And we also know there's been lots of studies done in the States where they've shown females have got pregnant post vaccination or even when they got the vaccination. What we find is, especially in women who get pregnant, their immune system drops. There's also the chance of getting gestational diabetes and also some other conditions. They are much more susceptible to getting infected. And if they do get infected, there's a chance that they could end up in hospital. There's 5 times chance of end up in hospital compared to a non-pregnant woman, or they could even have they could even lose their babies during. And we know, if you look at Sunshine Hospital, there's an article done a couple of weeks ago about the number of pregnant women, and the doctors, especially some of the gynecologists or obstetricians, mentioned that some of their patients have ended up and they've lost their babies, and they're also fighting for their life because they did not get vaccinated as well. So it is recommended to get vaccinated as soon as possible. You don't need to delay getting pregnant if you have got vaccinated. If you're pregnant, you can still get vaccinated. Talk to your doctors, talk to your GPs, talk to your specialists, and they will give you the correct advice when to get vaccinated. Again, we are finding research showing that women who are pregnant have indirect protection to the babies by transferring antibodies through the placenta or through the breast milk if they're breastfeeding as well. So with disability, people with special requirements or disability and their carers can get the COVID vaccine. This has been ongoing. The support is there not only for the person who requires, but also for their carers. The booster shot is now available for anyone over the age of 18 and who has 6 months after their second dose, they can get the booster shot. People with disability or special requirements, including people who use Auslan, and people who have autism, may visit any vaccination site and get vaccinated. You don't need a booking or an appointment to get your vaccination. Also, the Victorian vaccination state-run sites will ensure Australian interpreters will be available to support you as well. You can also look at the Australian Victorian government site for more information. I just wanted to give, this is a whole lot of state-run sites which are specialists in offering for people with disability. I'll share these links so you can have a look at them. There are the various, there are 9 key sites that have special facilities for people with disability as well. So if, for example, due to various reasons, due to some disability or maybe even sometimes psychological issues, or sometimes because people have been in lockdown, they sometimes might have the fear of going out into the community, there is support available for you to get vaccinated at home. So you could contact the disability liaison officers and make a booking so they could come in and give you the vaccination at home as well. So there's a lot of support available for people who are not mobile and who need the vaccination at home. This is provided by the state as well. So again, there is this, I just downloaded these 3 documents which shows you, they're really good ones. They're like visual effects of what you would expect to see if you go to your GP, if you go to a vaccination site, or you're going to a drive. Sorry, my cat is go to a vaccination site to get a COVID vaccine. What is the advantages of getting vaccinated? It's very effective. It keeps you from spreading the virus to other people. It also keeps you from getting seriously ill. You need to get both doses of the vaccine to build up that 90+%. We know as time goes that even the immunity can wane, the memory can wane. As I mentioned, the vaccine will not give you COVID at all. We also have scientific evidence, lots of research that has come out saying that people who are vaccinated prevent the virus from mutating. We want to prevent it as much as possible because otherwise we are going to have constantly new mutants occurring. Generally, it takes about 2 to 3 weeks after the first dose before you start building up immunity. So do not wait until somebody is sick or your neighbor is sick or you have somebody in the house is sick to get vaccinated. If you're already infected, the vaccine will not work. The vaccine is not a treatment. Vaccine is a preventative measure. You most probably getting COVID or severely falling sick. So getting the vaccine when you're sick is not going to stop the infection. It's not going to reduce the infection. But what we want to do is get you vaccinated well in advance, so we can prevent you falling seriously ill or not getting COVID at all. Now, generally, it is recommended that if you have been if you have had COVID, you will have the antibodies, and that antibodies might be there, and that information will be there in your memory. So it lasts for about 6 months. So it is recommended generally to have the vaccine after 6 months. But in this current situation, given that we are in, sorry, I just want to go to this. Given that we are in outbreak, we are living with COVID. It is recommended that when you come out of COVID, you are given a clear certificate that go and get vaccinated within 2 weeks. Now, if a person who's had COVID and if they've been in hospital, sometimes they've been treated with sotrovimab, which sort of to keep you stable and also to reduce the severity of the infection. So you then can take the vaccine 3 months after recovery. So the doctors, you get the doctors to give you the so the 6 months exemption of people who want to do that. But today, the doctor will have to upload this into the Australian immunization register. He cannot just give you a letter. The letter is not acceptable anymore. This was changed from Friday, the 12th of November. So it has to all go into your service app, and that will be recorded there, and that will be available if you are doing checks as well. So what I wanted to show you was vaccines are not new. We all know about vaccines. We have all gone through various immunization programs. Today, like if you look at some of these immunization programs, there are 14 diseases we control due to vaccine, polio, tetanus, measles, influenza. Some of them are like one-off vaccinations. Some of them are where you go, like for example, with tetanus, you go once in 10 years to get a booster shot. With your influenza, you know the flu vaccines you take once a year. It can be with some other pneumococcal vaccine, you might take once in 3 years, once in 4 years. So some vaccines are different. Some vaccines can give you immunity for lifelong as well. Now, you are considered to be fully vaccinated if you have had both doses. You have a valid medical exemption, because some people will have a genuine reason why they cannot be vaccinated. So that will also be through the exemption process, and you're under 16, you won't be required to have a certificate. This is the MyGov app, service app. You have it, and when you check in anywhere, this is what you'll be using as well. Now, as of 28th October, ATAGI approved a booster shot. You would have heard right across the world, they're starting to give booster shots. What they're finding out is that after 6 months after vaccination, that your memory, it's called the waning memory, the memory of being able to produce the antibodies keeps dropping and can drop to about 70%. So what we want to do, what the health authorities want to do is build up that immunity, take it back to that 98%, 97%, 90+%. So giving people the booster shot will help them keep that information in their memory, so that if they do get the infection, they will be able to fight back much better than if they had a drop in their memory, which comes down to 76%. So the booster shot is not mandatory at the moment. It is provides you a higher level of immunity as well. So we are strongly encouraging when your time comes, you are not going to get a message from the Department of Health saying you need to now go and get your booster shot. It is recommended that if you are immunocompromised, that you get vaccinated 28 days after your second shot. If you have not done that, it's never too late to do that. And general population, 6 months after your second dose, it'll be ideal to get your booster shot done as well. Thank you very much. I'll stop sharing at this stage, and I'm happy to take any questions.
Thank you, Dr. Mohamed. That's a well-informed session. Yes, any quick questions for the doctor regarding to the presentation about COVID-19 vaccination? If we have any questions, quick questions, we will.
Abdi, can I ask a question just to Dr. Mohamed? First of all, thank you, Dr. Mohamed, for the great presentation. Just got a question around Novavax. I know that the government has purchased it, but hasn't released it due to TGA regulations. Can you give us any sort of information on whether that's going to be available?
So, yeah, thank you. That's a good question. And I will quote what Professor Ben Cowley mentioned. He is the Chief Acting Medical Officer. They're still, you can see Novavax is not even being used internationally as such. They're still doing a lot of work on it. Still a lot of research is coming through. So they're waiting for more data. So ATAGI, which is the body that approves any form of treatment in Australia, any health treatment in Australia, will monitor it very carefully. At this stage, we don't expect to see Novavax even, although we have purchased it, we don't expect to see Novavax even early in the year. It might take a little more time before Novavax comes. We got 3 fantastic vaccines with you. Get one of them. They're all 3 very effective. So that will protect you until when Novavax, or maybe when Novavax come, maybe that's the time, maybe you people might think of another booster shot, because I've got 2 of my colleagues here. Dr. Sarah Henderson is also here, and I think and Aurora is also. So they're both having a lot of medical background. They'll be also able to answer and support, but it is something to think very carefully. There's no point waiting for Novavax. We have got 3 fantastic vaccines. All 3 are effective. There's a lot of support available. If there's any side effects, get vaccinated and protect yourself. I'll be here until about 2 to 2, and I'll leave because I got to go for a training. But you got 2, I think, and also you got Lizzie as well, and also going to talk, and you got Dr. Sarah Anderson and Aurora Tang as well for the department to answer more questions. But I'm happy to take some questions now.
Thank you, Doctor. Yeah, I think Dr. Mohamed is leaving soon. So if one more question, if you have, otherwise we will allow Doctor to go another his program. Yeah.
I've got a question to Mohamed Abdi.
Yep.
Hi, Mohamed. It was again a wonderful session. Thank you so much. I was just wondering if the person have a intellectual disability and can't make a decision to get vaccinated or not vaccinated, who is going to make a decision on behalf of that person, or what is the process to follow up?
So I think people with intellectual disability would have a guardian. I think most people. Sarah, maybe you might be able to come in. I think you've done a lot of work in this. I think you might be able to come in, and I think it'll be the guardians who will make the decisions, if I'm not mistaken. Yeah.
Yes, that's true, Mohamed. The other option is that the Office of the Public Advocate can make a decision for that person. Lizzie Castles is also on the line. She has a lot of experience in this area. Lizzie, did you want to comment here as well?
Yes, thank you, Sarah. And look, it's a really good question, and it's one that we're finding is coming up more and more. So exactly as Mohamed and Sarah have both said, there are options for people who are either unable to make their own decision, or people that need to communicate in a method other than, talking. They might be able to sign, they might be able to communicate using assistive technology. At the moment, the Commonwealth Government is aware that there are lots of questions happening regarding the consent process, and they're in the process of developing some easy read formats for the consent form, which should hopefully help address those with both intellectual disabilities, but may also be advantageous for people whose first language is not English. If you are having questions regarding the consent process, I would recommend that you make a referral through to the Disability Liaison Officer, which is the program I'll speak about in a minute. The DLOs have got lots of experience in working through how to address consent with a concerned family member or a carer, and are across the regulations in terms of medical power of attorneys versus guardians versus parents, and who can and cannot make the decision on behalf of an individual. So I'd always recommend that if there's concern, you reach out to a DLO, and they'll be able to help assist you through the process, as well as make sure that the booking's appropriate to the individual's needs. Yeah.
Thank you, Lizzie, and thank you, Dr. Mohamed, as well as Dr. Sarah. So, yeah, I think if there is no any other question, we'll leave Dr. Mohamed just to go ahead to another program.
One more question. Can
I can answer. Okay, good.
just quickly, do we know what's in? Is the booster shot got the protein spike that you're talking about as well, or is it something different as well?
Sorry.
So the booster shots, are they very the same as the Pfizer, or are they going to be different as well? What's inside the booster shots?
So the booster shot is the same vaccine, so there's no difference, and it is just like, like when you get the first dose, you will have about 78% of immunity. The second dose takes you up to about 97%. So over the period of time, what we refer to as waning memory. So the information, because we all keep it in our memory to produce these antibodies as time goes, that keeps dropping, and that can, like research is showing, that dropping to about 76%. So the booster shot again is the same vaccine, which will just take it up and take you back to that 98% level. So there's no difference in the vaccine. Yeah.
Thank you, Dr. Mohamed. Thank you.
Thank you very much, and have a lovely afternoon. And sorry, I got to leave to undergoing training.
Thank you, Dr. Mohamed.
Bye.
Thank you. Bye-bye.
Thank you.
Abdi, I just wanted to mention that also considering intellectual disability, people who have also people with autism too, because people will sit on the spectrum and they will have very specific needs that the medical health professionals and the DLOs can support. So that's another sort of consideration too.
Thank you. Thank you, Sarah.
And also, if Lizzie can please provide her email to us, so we can share that with people who may need that specific help.
Absolutely. The DLO team will help us today. That just where we can get all these contact numbers, how to deal with everything. Yeah. So thank you, everyone. We'll now come to the next our next guest speaker, who is. I think, is Yuli. I'm not sure.
Yes, Yuli is with us.
He's with us. Yeah, good,
yes.
good. The COVID-19 vaccination community champion. If I just say a few words about Yuli. Yuli is a testimony of how the strength and resilience of human spirit can carry you through the most dire of circumstances. Born into slower of chronic health condition, Yuli was given a 0% chance of making it past his second birthday. He was born with less than 50% of his lungs functioning and medical issues that prevented him from having the ability to really eat. Living in a hospital can have a detrimental impact on your mental health. But Yuli found a way to overflow with positivity and cheerfulness, adapting the hospital staff surrounding him as the surrogate family. Now, a young man living in a support share home, Yuli has found independence and a way to thrive while still being supported through his mental health challenges, chronic illness and disability. In 2021, after highlighting to the Royal Commission concerns around the vaccine rollout amongst those with disability, Yuli started working with Victorian government, helping spread awareness and addressing concerns as their COVID vaccination community champion. I now welcome Yuli to talk about his experience. Thank you.
Thank you. Thank you so much for the very lovely introduction. I feel very overqualified, but I appreciate the introduction. I was lucky enough to get my vaccine in about mid-June, so I had it about 6 months ago now. It was quite easy. They came to my home and they gave me my vaccine in my own kitchen, which was great. I consented for AstraZeneca, and then the Prime Minister changed about a week later to do Pfizer. So I obviously consent was a problem because I consented for one, vaccine, and they changed their advice. Well, luckily I got Pfizer, which was great. I think the thing that would have been great is the DLO. Yes, I think I've read about the DLO, and I reckon it's a great thing. Autism is definitely an issue. I don't have it myself, but I've seen people that have autism, and it can be very overwhelming. A lot of stimulation. But from a cultural perspective, my biological parents are Turkish. So I come from a Muslim background. I don't practice it, nor do I speak it, but I got raised by a Maltese family. But I recently found out that my father is actually in hospital with COVID. And I've never been, as you knew, as in the introduction, I spent most of my life in hospital. So I've never been super close with my dad. But it's still disappointing. I would assume that I don't think he was an anti-vaxxer. I think his beliefs felt like it wasn't a problem. He didn't need to get it. But I think my recommendation is I've been quite lucky. There are people out there that aren't so lucky. And with my extensive time in hospital, I would say that no one can be right. The community can't be right. The government can't be right. The virus will do what the virus wants to do. We're not mind readers. We can't predict everything. But I would say get the shot, because yes, there was some side effects, but there's some side effects with anything. In medicine, I'm not sure if people know, but because I've spent most of my time in hospital, there's always side effects to anything. You get put to sleep, you have a medication, antibacterial, chest infection, whatever it is. There is always side effects. The worst that I had was when I got my second shot, I had a slight headache, but it passed. And I think I know from lived experience about having a Turkish family, it can be very different culturally. There can be differences and it can be very hard. But I would just say, if you don't have to get it if you don't want to, but at least be mature enough and responsible enough to listen to the possible side effects and be reasonable, because I am now sitting here in the last couple of days thinking to myself, do I mend things with my dad? I can't go and see him because he's in ICU with COVID and I've got a lung condition. So there's no way I can put myself at that. But now I have to sit here and be like, well, never had a relationship with my father. I never really wanted one, but now he's sick with COVID. Like, it'll affect your family members. It'll affect the people around you. But it can be scary. It can be overwhelming. When I first got it, I was very nervous about whether it was safe or not. And I found comfort and acceptance that the federal government and the Victorian government would not recommend something that would be dangerous, because it would be like they would have lawsuits, they would get sued, it would be negligence. So it has to be safe. I don't know what else to say. I hope I gave some insight. I'm sorry I can't be as more useful than that, but yeah, if there's any questions, more than happy to ask.
Thank you, Yuli. That's a really insightful story. My question is, do you think like people who were born, for example, overseas other than Australia, who maybe have not taken any other vaccination, will have more hesitancy than the people who were born here in Australia?
I don't know. Maybe. But okay, so I have to say yes, because my father always turned around and said to me, I don't like the Australian government. I don't believe in, commercial media. So unfortunately, I would have to say yes, but that's, to me, is an unfair response. Like, I wouldn't judge going to Turkey or going to, Iran or Afghanistan or America or Canada, because we're all in the same boat. We're all in the scenario. Unfortunately, I have to be the bearer of bad news and probably agree with you. Yeah.
Thank you. Thank you.
Yeah. Just Abdi, I wanted to say thank you to Yuli. And I'm also Turkish myself. And like when you said there's all these cultural, things that are happening around, just trying to get the education and understanding and as to how individuals can keep themselves safe, their family, and, sort of friends and extended community and that kind of thing. So like, I'm just thinking, like, what would you, with your lived experience, say that what is the disinterest? Why is there disinterest in receiving the education, as in the valid, reliable education, not from people, not from listening to one another or over the phone or social media, and then that disinterest, and then after that disinterest, then taking the right course, the right steps in order to. What would you think would be some of the levels?
I think cultural diverse background, I think overall we have an older demographic. Like there's no, like I reckon, like Muslim people or American people, like young kids that were in high school would listen to it. But I think we just have an older demographic, and that's, I don't think mental towards cultural diverse people. I know older Australians that just don't want to hear it. Like they're very old school. I don't know, because I've been told by my father over the years, not just by COVID, by everything. I don't trust the Australian government. I don't like commercial media. I don't believe what they say. Sometimes the extremists are just like, oh, it's run by Illuminati, this and that. We need to get them to. I'm not saying people are selfish, but it comes off as selfish. You know what I mean? We just need to get them to listen somehow in a form that they understand. And I think it's because every country is at a different stage and they say different things. Like, for example, my father doesn't watch Australian news. He goes online and watches Turkish news.
That is my mum.
Yeah. And doesn't watch. So it's just like, well, I don't know. I don't have an answer for you, but I think it's
very laissez-faire. I've been watching like documentaries, travel documentaries about Turkey and different cities, and people are just looking like so carefree. Like they were already carefree pre-COVID, and they're still pre-COVID. But saying that, like my neighbour in Turkey, she's saying they're pretty highly vaccinated. So there is some incentive that the government is giving them. So does that mean that the government needs to give more incentives to people, as in
maybe
forms of incentives? I mean, is that what's working in Turkey, and maybe some other multicultural countries around the world? So we'll need to look at how it would be, let's say in Iran or Lebanon or in India or whatever, and see how it works within their community and how the government sort of communicates that message and how it seems to work, and they're getting the right education, it's valid and reliable. And then once they get that and they have that understanding, then they're taking the precautionary steps. I think maybe we need to not look at it just here in Victoria and then or Australia. We need to look at it out of Australia.
I think I think there needs to be an incentive, but I also think we need to respect and acknowledge their beliefs, because one of the that haunts me for a very long time is when I was about 5 years old, I had to have a special catheter put into my body so they can put like antibiotics into my body straight away, because I have really bad veins. And my dad's response was, inshallah, like Allah will take care of him. He doesn't need that. I want pure blood, which is fair enough. Okay. But your son was going to die if they didn't force his hand. So there's a part of me that's just like, we can't change their beliefs. We can't change their mind. But I think if we do have to face that massive obstacle, we need to respect their beliefs and somehow integrate it. Somehow.
Yes. Show that respect. Yes, I understand what you mean.
Thank you very much. Thank you, Yuli.
Yeah, thank you.
I have to interrupt you. We're running out of time.
Okay.
I really appreciate that point. For the Yuli says that we need to respect their culture and their belief, and then try to integrate and just, accommodate whatever they believe, and try to educate them, and then show them in a positive way. I agree with you, Yuli. Thank you very much. It's a good insight. Yeah. If we had a time, we're gonna continue next part after we finish this group. So can I just welcome the dialogue group, which is Elizabeth and her team. Elizabeth is a statewide coordinator, Victorian Disability Liaison Officer Program, Commissioning and a System Improvement Decision, Department of Health. And she'll be sharing information about DLO program, how they can support people living with disability and their carers. Thank you. I just hand over to Lizzie or Elizabeth. Thank you.
Thank you very much for the introduction, and thanks for having me here today. I'd also just like to quickly acknowledge the traditional owners on the lands on which we meet today and pay my respect to elders past, present and emerging. I'm on the land of the Wurundjeri people. Thank you, Yuli. That was a really fantastic insight into your lived experience and lived experience of getting a vaccination as well. And also thank you very much to Mohamed and your presentation on the vaccination. I think I've heard a lot of information about the vaccination as a lot of us have over the last little while. But it's always really reassuring to hear how much research has gone into the vaccination and just how safe we know that it is. Today I'm here to talk about the Disability Liaison Officer, or the DLO program, which is a program that I coordinate for the Victorian government. So we are a team of over about 40 now DLOs who are positioned across all of Victoria. So we're based in health services and we're based in metropolitan Melbourne as well as regional and rural Victoria. And the DLOs are a group of health professionals, so both allied health professionals and nurses by background and disability workers, who are essentially there to make sure that people with disabilities can access health needs, basic health needs, such as trying to get a blood test at your local doctor, or more importantly at the moment, or not more importantly, but equally as importantly at the moment, to try and access a vaccination. So since the 1st of June, our program has assisted over 7,500 people who identify as having a disability to actually receive a vaccination. And the beauty of our program is, rather than being based, in the big hubs that are run by lots of the health services, the DLOs book people in everywhere and anywhere. We book people into some of the hubs that might have quieter spaces. We help to book people into their GPs, their local pharmacists, into some of the accessible hubs, which Mohamed mentioned earlier, which I'll talk about in a second. We also can help to organise in-home in-reach if someone requires to be vaccinated at home because they may have limiting factors, which means they're unable to leave their home easily. And we can also help to organise vaccinations with significant distractions in place or mild sedation if someone has a significant needle phobia or might need a little bit of sedation to actually receive a vaccination. So I guess it's worth noting that the DLOs work with the individual. So they don't necessarily work, with the broad public, with hundreds of thousands of people at a time. But what we really offer is that bespoke model. So when we get a referral for someone or from someone for someone they may care for, we really work out what it is this individual might actually need to get vaccinated. So it might be, that there's a younger adult with autism, for example, and they may or may not have the ability to make their own decision regarding vaccination, and they may have significant anxieties regarding going into a busy or a complex environment that may overwhelm them and may make them have act out or have behaviours of concern. So the sort of things that the DLO would be doing in that instance is working with the individual and their families or their carers to, number one, work out what's the best way to communicate with that individual. Do we need an interpreter from speaking a different language? Do we need an Auslan interpreter? Do we need to be taking them to their GP where they already know the GP, but they might need a double appointment to get a vaccination rather than a single appointment? Or do we try and book them into one of the accessible clinics where we have longer appointment times and a much calmer, quieter environment with less distractions in place? So the DLOs have worked with a lot of the peak bodies, including Amaze, to create things like the social stories, which Mohamed mentioned earlier, which are a really good tool to talk people through and to show people what to expect when you're actually coming to a vaccination appointment. I mention these because they're not just relevant for the autistic population. They're a really good visual guide for anyone to use in terms of what to plan through when you're receiving a vaccination. I guess I've just realised that I missed out on saying that DLOs can also book people into drive-through vaccinations, which is a really good way if someone can actually get into a car but may have hesitations or limitations in terms of accessing a building. The DLOs, certainly in metropolitan Melbourne, can assist people to book in for a drive-through vaccination appointment. I guess the most important thing is to note is that we can also work with people regarding vaccination hesitancy or any questions people may have about receiving the vaccine. And when we have different options in different areas, and the DLOs who work across the state know exactly what's available in their area. And they're also able to organise some small group bookings. So, for example, if you knew of 5 or 6 participants that would be best served by having in-reach to their disability accommodation or to their day program, for example, again, that's something that the DLOs can assist with. I could talk for hours about the program and some of the success stories, but I know we've received a lot of information today. I've popped in the chat there the information which is on the state government's page, which is called Information for People with a Disability or Special Needs. And I've also put in the link there to our DLO referral form. I guess I just wanted to share one quick story with you, if I may, just I guess to suggest what vaccination actually means for individuals out there. So excuse me for reading, but I want to get the story right. I really just want to share my story regarding my son Peter's vaccination process because the DLO was outstanding and helped to assist him get vaccinated. So Peter required additional assistance in terms of having a quieter environment, a social story, and a slower, more thoughtful approach to actually get vaccinated. This was successful due to the lovely support and kind approach of the DLO. And then a week later, we received another email, which is, on Friday night, my partner and I brought Peter with us to our favourite local venue, and it's a small bar and restaurant with a pub-like environment. Peter was so happy to be going out there as everyone there knows him and he feels comfortable. The owner and her staff didn't mind that he didn't sit down and that he likes to stand up and watch what's going on behind the bar. It hit home for us how important it is for Peter to be vaccinated and to have access again to all his freedoms, not to mention how awesome it was for us to be there amongst all the vaccinated people and to be safe having a meal out. I think what this really does for me is it really just highlights that vaccination is absolutely our ticket to getting out of the situation that we're in. I think, as mentioned before, there's some dialogue regarding people from obviously a variety of different backgrounds who speak a variety of different languages, and English isn't necessarily their first language. I guess I would always really be focusing on what vaccination actually means for them in the long run. Yes, it might be 1 or 2 minutes where it's it's quite tense and quite receiving the needle itself can be a little bit uncomfortable. But what it actually means is it's your ticket to freedom. We know people with disabilities are at increased rate of getting the coronavirus, and we know that people with disabilities normally come in close contact with quite a few individuals on a regular basis. So they may have closer contact with family who are providing care for them. They may be at a disability residential house where there are lots of different carers coming in. So we need to be doing what we can to really support these individuals to get vaccinated. And I guess I just want to really emphasise that the DLOs are very much a slow and considered approach to working out what the individual might need to get vaccinated, whether or not it's a one-on-one appointment in an environment that's just with someone that they know, whether or not they need ABBA music playing, for example, whether or not they need to bring a therapy dog in. We can make all sorts of these accommodations to make it successful for you. The thing we don't know is who people are. So I guess I'll just encourage you to spread the word about our service. We're an absolutely free service. We're run through health services, so we're available across Victoria, but please spread the word about our service and please reach out if you've got any questions or concerns. I'm mindful of time, Abdi, but I'm happy to take any questions if there are any.
Yeah, can I ask a question, please, Abdi?
Yep.
I just wanted to know, do people with disabilities get to choose which vaccine they want, or is that something that you or the DLO actually talks about? Who makes that decision of which vaccine they actually want?
Yeah. Sorry, I cut you off there.
No, that's okay. That's okay. I just wanted to know if they've got the choice of choosing AstraZeneca, Moderna, or like, how do you make that prediction if they've got an intellectual communication problem?
Yeah, look, that's a really good question. I guess to mirror what Mohamed said earlier in the presentation, and what Professor Brett Sutton has been saying, the best vaccination is the available vaccination. But obviously, like any other Australian, people with disability absolutely have the right to choose which vaccination they're receiving. That being said, I would highly recommend that they're getting a vaccination that is available right now, and that they're not waiting. So what we do is we make sure that we, like with anyone receiving a vaccination, we'd be speaking through the minimal risks that are associated with any of the vaccinations, and be making sure that a thorough consent process is completed. It's actually the vaccinator's responsibility to do that, but we'd be working with the vaccinator to say, actually, you know, Yusuf needs to work with a Turkish interpreter, for example, or needs to work with an Auslan interpreter. So we'd be there to make sure that the process works and that their needs are met. We wouldn't be determining which vaccination they can or can't have. Obviously, if someone has had a specific reaction to a vaccination and they need to have one rather than the other, that's totally fine. Once we know that information, we'll be making sure that we're linking them in with a service that provides that specific vaccination. Does that answer your question?
Yeah, it does. Thanks, Lizzie.
No problems.
Thank you, Lizzie. If there is no any other one has a question, I could ask a question. Anyone has a question first? Because I would like to be last. Okay, thank you, Lizzie. This is really a good service. I have tried one before, because to share with you, a mom which has a daughter with a Down syndrome contacted me and asked me a request for that, and I have Googled out and just got a DLO form, and I fill out. They contacted me 3 days later. They asked me the questions that you're telling me, the interpreter, blah, blah, blah. What I was looking for that day was for them to get home, to give vaccination home. But she said to me, they have some specific, community center where nurses which have been, trained for that. And I said, the young daughter, I know she might run away because they take her to the GB, and the moment they start injection, she ran away. They say, no, they know their way to distract her, to play with her. Yeah. And luckily they did very safely, and I was very happy. And the mother was very, very happy. And since then I was trying everyone to share with this message, DLO, what they do in the community. So my question here, that's a really good insight. To the DLO, for example, when they're booking for such person which has disability, whether it could be autism or Down syndrome or any other disability, do they consider their medical history?
Yeah, that's a really good question. So the DLOs are not doctors. Yep. So in terms of the medical history, so can someone have this vaccination versus that vaccination if they've had an allergic reaction in the past? No, we don't make that decision, but we can certainly help you to get in touch with the doctor or the service that can make that decision. Good. What we absolutely do is consider all the other information. So not necessarily health, but disability information or accessibility information. Yep. So, for example, if we know that someone is likely to have a significant fear reaction to a needle, and that they're likely to run away, and they may have tried in advance, already to have a vaccination, we would absolutely be looking for the safest environment for them to be going into. So we'd work through with the parents or with the individual, depending on the situation, to work out what the best environment might be. And it might be that it's going to be an accessible clinic and we might be able to get them in, pretty quickly within a couple of days or so. And if that isn't going to work, then we can absolutely look to do in-home vaccination for an individual. I guess one of the things, the most important thing we know is that people with disabilities know what they can and can't do. Their families know what they can and can't do. Our role is to not tell them you can do this, you can't do that. Our role is to ask them and to see how we can facilitate that or to make that work. People with disabilities are absolutely the experts in their own ability, and our role is really just, to make sure that they have access to this really important piece of health, which is vaccination. Yeah, I'm glad to hear that the little girl had a good outcome. That's fantastic.
Yeah, absolutely fantastic. Yeah. Well, look, thank
Um,
you, Lizzie, and the other team. Any other one to add or to ask question or to add thoughts?
Can I just ask a question? So when we're in day services, I know there's quite a large people who have informal communication problems, and it's quite tricky to get, a lot of people to have their informed consent regarding whether they do want to get vaccinated. It's really an acquired skill. Are DLOs, are they trained professionals when it comes to those sort of informal communication problems, and how does that process work for people in day services?
Yeah, look, that's a really good question. So DLOs have a variety of different backgrounds. A lot of them are therapists by background. So, for example, I'm an occupational therapist by background. Within the DLO program, we have occupational therapists, social workers, speech pathologists, physiotherapists, nurses with mental health backgrounds. What else do we have? People who have worked as disability support workers, people who have worked in disability employment. So we've got a really a vast array of individuals who work in the DLO roles. The important thing to note is that they all have experience in working with people with disabilities, and they all have a variety of different knowledge and expertise. And what we really do is we work as a group to think about what your skill sets are and what each other's strengths are, and we really share knowledge all the time. So we meet on a fortnightly basis and make sure that we're, sharing knowledge, sharing what's worked well, sharing what hasn't worked, and really share resources. So again, in terms of working with an individual who has specific communication needs, what we would be doing is absolutely, number one, addressing the individual themselves, and then linking in with their families or their identified carers or their services to think about how it is that we're going to make sure that they have informed consent. Because the most important thing is that everyone is able to access a vaccination, and everyone has that ability, or everyone has that option, I should say, to make an informed consent. And we take that really seriously because it's a significant human right, and it's one that we as a service absolutely need to uphold and want to uphold to make sure we're doing the right thing by people. Yeah, but it's a good question. Yeah, good question.
Thank you for that. That's a really good answer. Thank you.
Oh, no problem.
I think Sarah is asking question in the chat box.
Yes.
You can ask.
Yes, this morning, this is my disability advocate role, but I work as a Speak My Language traveller too. So this morning I had a podcast with somebody who had an invincible disability. And after the interview, we had a short discussion. So she has MS, and, for MS, chronic fatigue, fibromyalgia. So all the symptoms within those invincible disabilities are very similar to the symptoms that are prevalent for COVID symptoms. So what do people with invincible disabilities do if they're in that limbo situation of not knowing, is it what I have, my chronic condition, my chronic disability, or is it that I have COVID that I have to get tested? And that is just so challenging.
It's immensely challenging, isn't it? And I've got a very close family member with an autoimmune condition who has had numerous COVID tests for a very similar reason. And look, I can't say that this is exactly what they must do or mustn't do. I think the best advice to give is that they're the experts in their own condition. It's for them to be linking in with their doctor, who will probably know if they're having a flare-up of their condition. But realistically, the only way that you can rule out that you do or don't have COVID-19 is by having a test. And I think it's worth noting that the DLOs can also assist to organise a test for you. So whether or not that's an in-home test, so you can have a call to test service and an in-home test, or whether or not that's recommending a testing centre that might have a shorter line, or where you might be able to flag, actually, this individual can't stand in line, they need to go to a drive-through if they're able to drive, for example. So I think that's something that we're seeing quite commonly at the moment, and I think there's a lot of people who have been experiencing other conditions over the last year or two. There's a lot of fatigue out there, a lot of people who have been working hard, who are tired, who haven't seen loved ones for a long time. And I think there's a lot of, people are experiencing either flare-ups of underlying conditions or new conditions. So my number one piece of advice would be is if you're not sure, get tested. But also to link in with your standard health practitioners or your general health team, just to discuss the symptoms that you are experiencing, to see, whether or not there's any further investigations that you need to be having. Yeah.
Thank you, Lizzie. That was a very thorough answer. So, yeah, I will pass on that message. Thank you.
No problem.
Thank you, Lizzie. Thank you. It's really a great answer as well to all the questions. I think if we have any other questions, that's fine. Otherwise, we came to the conclusion. I would like to thank all the participants here, such as Dr. Lizzie, Sarah, Yusuf, Sarah, James, all of you, Giovanni, Suzanne. I would like to thank everyone here, and it's really a great benefit from DLO program, as well as Yuli, who has shared with us the good insights. Yeah, that's all. Anyone wants to add things or comments?
I just want to say thank you to you, Abdi, for running this, and you've done a great job. So thank you very much, and
thank you
to everyone for all the information they provide. Thank you.
Yeah, thank you everyone for being here, and thank you DLO team as well.